If you're a personal trainer and your client has knee pain, you're going to want to watch today's video. Make sure to like and subscribe. And if you want to become a successful personal trainer, check out my book, as our certification is one of the fastest growing and it's recognized globally. Make sure to show up. The knee is a complex joint. There are 14 muscles around the knee, all things that we cover within our certification. I'm not going to bore you with that today. 9 of them are biarticulate. Some start at the hip, some start at the ankle. So we need to look at the whole chain, the lower limb. What could be going on? Is it acute or is it more chronic? Acute would be playing football over the weekend. You twisted in the transverse plane, you heard a snap. Not a good sign. You probably blew out one of those 4 ligaments of the knee, probably the ACL, but we're not doctors. We don't know, but we want to eliminate those red flags. The client comes in and they're doing a lot of work over the weekend. It's really swollen. That's not in our scope. You should have a physical therapist on your team. We work closely with the prehab guys, Dr. Waterbury at USC. So if there's anything we're uncertain of, we can reach out and get an immediate answer. Trainers want to be respected. You should have medical professionals on your team, registered dietitians, physical therapists, doctors. When you reach out to them, you're building your network, which is ultimately your net worth. The more you have on the team, the better trainer you're going to be. We look into the biopsychosocial model of pain. There's a psychological factor. There's a biological factor, meaning the body, if it happened then, or if it happened 25 years ago. And then there's a social aspect, biopsychosocial. What's going on in the brain? Deadlifts are bad for your back. Squatting is going to hurt your knees, as does running. You hear this, so it's a seed planted in your brain. The social part in your favor, the placebo effect is going to more than likely work. Take a look at the most famous person on Instagram today, knees over toes guy, ATG exercises. When you read the comments, everyone says it works. Your brain is saying, there's hope for me. Well, what if there was 100 people that went through his exercise suggestions and 20 got results and they post about their success? What about the other 80? The techniques that we're going to show you today are looking at the bigger picture. As the professional, you're going to eliminate range of motion concerns. Maybe there's a deficit there. What about stability and strength? What are the best mobility drills and then the soft tissue techniques that we teach within our certification? There are 10 of them. You are a competent medical professional. Trainers look at themselves more as influencers, and we're battling online. When you work over here with the medical team, you are practicing in that manner. You are a professional. So when you're able to screen properly and when in doubt, refer out, you can address clients' knee pain. So the first thing, you're going through the assessment. You eliminate any of the acute variables. You have the client sign the consent form because you are going to implement some soft tissue mobilization techniques. And now we're going to take a look at the lowest hanging fruit, which is going to be the ankle. We have our instructor, Megan. She teaches our in-person certification. 2 months, you will become an elite qualified trainer when you show up and gain that hands-on experience. We go over a lot about anatomy. There are 52 bones in the lower half when it comes to the tarsal bones. We're not going to name them all off, the calcaneus and so forth, but we're looking at dorsiflexion and what the ankle is capable of doing. We should be at about 15 degrees minimally to start a running program. And if we don't have that, the rest of the system will begin to break down. We're only as strong as our weakest link. And if we have problems within that kinetic chain, maybe the knee will start talking to us. So to implement this screen, to eliminate if it's a mobility deficit at the ankle, 4 inches away from the wall, have your client take your shoes off. She has some loafers, that's fine. 4 inches about the size of your fist. We have a chalk mark on the wall. She should be able to get her knee to touch the wall without her heel coming off the ground. And if she can't, I'm going to want to get into that soft tissue. The lateral gastrocnemius, medial gastroc, the soleus, which would be a little more distal. I'm not a big fan of full rolling. Everyone does it and we're rolling around like it's a roller coaster ride. I prefer the soft tissue techniques because they're more aggressive, which is going to have a greater impact on the nervous system because that's ultimately all we're impacting. Changing up fascial connections, no. We are impacting the nervous system with that pressure. One of the largest organs in the human body. It's not my biceps, it's the skin. It's actually the second. Number one is the muscle. So when we put pressure on that sensitive area, it sends a message to the spinal column, which will then go up to the brain and send a message back to calm down. So if you retest it and there is a deficit, and now she has that range of motion, awesome. Let's get out there and train. It all depends on if we pass these tests. If she has the range of motion, great, now let's test strength. The stability aspect. Does she have the competency to do the required movements? There was a podcast I did with Dr. Mike from the Prehab guys, and we talk about the prerequisite strength requirements for runners. And if they can do 25 single leg calf raises, they are less likely to experience knee discomfort. So that's the test we're going to look at here. Let's see if Megan can face the wall, very lightly put her hands on the wall, take a dowel or a pole, and have her go up as high as she can and hold that position. You're going to mark it off, and you're going to hold this, and she should be able to complete 25 repetitions. No cheating, Megan. And what you're going to find for a lot of your clients, they're not able to do this. So what that means during the programming that we implement at Show Up with the CCA, the accessory, add in some calf raises. That wasn't 25 reps, but your clients aren't going to do their homework, so you can have them start off when they come in, 25 reps per leg. In the accessory, you can do 25 reps. As they start accumulating volume, over time, it's going to get easier, and you're probably going to notice that the knee pain is going to go away. So we've looked at a mobility deficit, a stability and strength deficit, and if those are both great, let's move up to the hip and see what the hip is capable of doing. Now we're going to take a look at the ball and socket joint, the hip. We should be able to get into all three planes of motion. But what we're going to test here is your client's capability of getting to roughly 35 to 45 degrees of internal rotation, and we're going to check out some dead space. And this is really important for eccentric control, because if you can't control that space and there's a drop, maybe that's what's causing the discomfort. You don't have control. So that pain is telling the brain to calm down, not be so aggressive, because there's that discrepancy and that deficit with that control, that neurological control. So we should be able to get to roughly 30 to 45 degrees of internal rotation right there. Now she has a decent amount. So what we would learn from this is, can we get there passively, which is taking your foot and bringing it up? And if you can get there, so that's say 45 degrees, and if you take your hand away and it goes boom, that's not good. That means you lack the neuromuscular control, and so maybe that's where that discomfort's coming from. It's always a case by case, but this is a great low-hanging fruit exercise, because if a client is like, can't even lift their leg off the ground, that means we can't maneuver in that transverse plane. If we have to stop unilaterally and hold that position and then change direction, we can't slow down and control it. So then your knee flops in, knee valgus, pop. There goes a weasel. And so this is a great test to see if they can get there by themselves, actively. Passively, can they get to that range that they should be able to? And then can they control it? And this is a great PNF variation, which the trainer can help with bringing a towel up. And you can also have your client apply externally, hold for 5, 4, 3, 2, 1. And then they're going to come up into the internal rotation. And be careful manipulating the client's joint here, because you're going into that mechanism. You're not going to be wrenching on her ankle here. You're slightly applying pressure, holding, release, and then go into the other one. And then apply pressure here. Proprioceptive neuromuscular facilitation is the PNF stretch here, where you will apply pressure, hold, relax, and go into the antagonistic movement or contract the antagonistic muscle. So we're going internal rotation, external rotation. And by doing this drill a few times, if you notice an improvement in the range of motion, then that's what we're going to focus on. So that's going to help with the mobility. Now let's take a look at adding stability by doing a plank. So these are two variations you can do. If the range of motion didn't increase by doing that prior drill, have your client do a plank. I like to have her lift her legs up, get some extension in there. The other leg, you can do some abduction, going back and forth, get some trainer engagement, have them press against you, create a powerful maximal voluntary contraction, which will look like this. Drive, 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 drive hard. Drive, 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 drive. 3, 2, 1, relax. And then go and test again. See if there's an improvement. If there's not an improvement, then we can go to the side. Let's do a side plank. Hold this position. If your client is strong enough, I would like to see her lift her leg up, do some repetitions in the frontal plane. You can apply some trainer engagement. Hold. 5, 4, 3, 2, 1. Make sure to press on the outside of the knee, not the lateral malleolus, which is the ankle bone. It's going to put a lot of pressure on the lateral part of the knee. The last thing we want to do is blow out one of our clients' ligaments because we're pressing too hard. That's why you have them sign a consent form and you understand the human body for what we can and cannot do as personal trainers. So we just went over some tests for mobility and stability. Now let's take a look at the soft tissue mobilization technique for the knee and the adductor magnus. Now we're going to get into the adductor magnus and the soft tissue mobilization technique. We teach these at our weekend seminars with our partnership at Lifetime. Every month we go to their gyms. It's open to trainers. You can check out our website, showupfitness.com. You're going to be around some of the top trainers and instructors in the world, learning these techniques to help get your clients out of discomfort. You implement these on your clients. It's a game changer, and that's going to allow for you to charge more and implement more streams of revenue, all things that we teach you with the Show Up Fitness CPT. So when you come to the seminar, we will go through how to do it, how to implement this technique. Dr. Waterbury, professor at USC, doctor of physical therapy, he works with us closely, helps build our curriculum so it's the best out there. So what we're going to do is implement this technique on the adductor magnus. When you find a sensitive spot, you need to breathe through it. Set these clear expectations with your clients. You want to look at their face and make sure it's not uncomfortable for them. Make sure you're not in their private area, staring in their eyes, whispering sweet nothings. You have to remember people are staring at you on the gym floor. So make it very professional. If you need to use a towel, use a towel. You will identify the vastus medialis, the hamstring muscles, which are the semimembranosus and semitendinosus. Those are the two guitar strings that you're going to feel. You're going to go up on her line on the pants right here. There's a nice little spot. This is the adductor magnus. This is going to release osmotic pressure around the knee. Even if it's lateral discomfort, implementing this technique immediately will help significantly. You're going to find a little sensitive spot. It's going to be very distal. The muscle starts more proximal, but we're going to the distal region for obvious reasons. We're not massaging. We're not manipulating the joint. We're just holding till we get to that 6 or 7. Breathe through it. It's common even to get some cold sweats. Just set those clear expectations. You don't want your client to freak out and fall off the table. You're going to hold, breathe through it on a scale of 1 to 10. What is that at?
Like a 6 now.
6. So maybe it was at a 7. When it comes down, you can either go to a new spot or you can apply more pressure. You will learn with the client that you have in front of you the appropriate amount. We're not trying to get to a 10. We want to be able to just apply enough, 6 or 7, breathe through it. You can do the breaths with them. And when they're down to a 2 or 3, we're just going to do 2 to 3 rounds. The more you work with your clients and implement the correctives, which we're going to show you next, you can go a little longer, but the first time, do it 1 or 2 times, all things that we cover within the certification. Take your thumb off, and you're going to experience what I call the zit effect. It hurts when you're doing it, just like you have a big zit on your face, but when you pop it, it feels great. So now what we're going to do, have her move and see how it feels. After the soft tissue mobilization technique, you would then come into a mobility drill. This is not a mobility drill. I would probably do the hip 90-90. There's numerous drills out there to increase that range of motion. And then we would get into some stability exercises like this one right here. Doc Waterbury loves to do this with clients that are recovering from ACL surgery. You'll have them get into a side plank position, abduct to at least midline, and can you hold for a minute? So you see how she's above midline, abducting, holding, once your client can get past 1 minute, you would go up in band strength. At the end, if you want to do a little bit of trainer engagement, you would just press down. 2 to 3 sets, and might as well just do both sides. Flip over, go back and forth. And this is a great stability drill to help with knee discomfort because you're getting into the frontal plane, strengthening hip muscles. It's going to help relieve discomfort at the knee. Typically, I suggest 1 to 2 stability and strengthening exercises. It depends on your client's condition state. We don't want to do so much work on the affected area that's really weak that's now going to compromise the rest of the workout when we get into the CCA and that May core pattern. What I mean by that is if we do all this lateral hip work, 10, 15 sets, and you get into back squatting, deadlifting, whatever your choice is, the glutes are so fatigued, you're probably going to compensate the form for the exercise, and we don't want that. This is one of my favorite ones to do. You're going to come up, runner's position. So you're going to hold, and now she's going to abduct out. I like the band on the toes because we have to get external rotation, which really fires up the glute max and med. Slowly come in, and that eccentric control is imperative. What you're going to see a lot is your client comes out, and then they go whoop, and they do not have that neuromuscular control. That's what we want to work on. So maybe we need to use a lighter band. Maybe we just need to use the inertia from the trainer, giving them a trainer-engaged variation. Do anywhere from 8 to 10 repetitions. This is a great warm-up to get into the workout. And one more variation for the stability exercise, which can play into mobility as well, is just using a stable support. You can use a dowel or a rack and drive your knee as far over your toes as possible. You're going to hold. You're going to feel a great stretch in your soleus. Obviously, we don't want to drive so much where you're going to pop your Achilles, but you want to apply just enough pressure. It's going to feel tight back there, and you're going to hold isometrically. This is a great frontal plane stabilizer. A lot of times we cannot support unilaterally in the frontal plane. So this is a great frontal plane exercise because your glutes really have to fire up. So by holding for a good 30 seconds, use your torso to lean over. 30, 45 seconds, a couple rounds. And every time your client comes back, you're now going to start with the soft tissue. Then you're going to get into the mobility and then stability and then get into the workout. Make sure to hit those 10 checkpoints of human movement. If you want to become a qualified, certified personal trainer for life, check out my book. Volume 2 is out. Our certification is online, in person in Santa Monica, and we have weekend seminars. You're going to get the workbook where you're going to gain hands-on experience implementing these soft tissue techniques. We're going to be in Austin early April, then we're going to be in San Francisco, then we're going to be in Sacramento at the end of the month at Lifetime. Check out showupfitness.com if you want to gain hands-on experience and keep showing up.